breast cancer early detection makes a lot of difference on the treatment part. First is self-breast examination to be done 8 days after the menses. If there is a problem, they should go to the nearby doctor, their family doctor, or whomever they trust to, who can examine the breast again. And then, if need be, we ask for a sonography of a breast. If need be, a mammography. Mammography are X-rays of the breast. And in mammography also, there is a new machine, which is a 3D machine, which is a very good machine. But that can show a dense breast. Young breast will be seen better in a 3D machine. Otherwise, a normal mammography, if need be, is done. And if the lump looks suspicious, then only a cancer surgeon will have a look. Early detection will help us with the treatment part. If the lump is small and detected early, the breast is not removed. We will remove only the small lump which is seen. A biopsy can be done or excision biopsy. The lump is removed with the biopsy part. So they don't lose the breast. They don't have any physical deformities. So that is why it becomes very important for the early detection. The treatment is less. Radiation and chemo may not be needed. Maybe radiation is needed, chemo is not needed. So the three parts of the cancer, if the lump is big, we know it is surgical. We come to chemotherapy and we go to radiation, and then now which is coming is target therapy, immunotherapy, everything is there. But if it is detected early and the lump is small, we can go in for a lumpectomy or an excision biopsy. And then if the histopathology doesn't show anything, maybe the chemo is not needed, or only radiation is needed, or some part of something is needed with the, which is it is a protocol. So that doesn't change anything. Every doctor, every oncologist will follow the protocol all over the world. So the smaller the lump, some lumps may not need anything, some will need some treatment. So it is early detection. We will have the clear picture after the histopathology comes, whether the radiation is needed, chemotherapy is needed, or excision biopsy is done. The treatment is over. The body doesn't need anything else apart from regular mammography and the sonography for the lady, and the treatment is okay. So early detection, the plus points are treatment is shorter, you are at peace, you are not worried, and then regular mammography will show you whether there is a recurrence or something. We are worried about recurrence part when the lump is removed. Once a cancer, always a cancer, that is what is said, you know. So you have to be very careful for the first 5 years, first 10 years. So every time that you do it, it doesn't mean that once it is not cured anytime. Many a times we say, but we nowadays, because the treatment is so good, we see 20 years plus and the lady is good. There is nothing. She is fine. She is happy. She is working normal. Lady doing everything. Even in young ladies who have cancer, after treatment, they can conceive also. It is not that they will not conceive. They are given some time period. For some time, you should not conceive. But after some time, under doctor's guidance, they can have a baby also. Because these days they get married late. Everything is late. But diseases have become early. The cancer which we used to see at 40, 45 years, we get 30s. So everything is changing now with the time. Lifestyle, everything has changed. So if we have early diagnosis, it is good for the lady, it is good for the family, it is good for her own mental side. So you have to take care of yourself, self-breast examination. Earlier you reach a doctor, early treatment, you will come to know whether it is a benign lump. 95% of the time it will be benign lump, so there is nothing to panic. Don't sit on a lump, please go to the doctor. That is the message for early detection.